Hi there. 4 years ago I kicked a small pot with my foot on my patio and ended up in a pretty bad place. I couldn't walk at all. I had excessive referred pain down both of my legs, a significant amount of pain. I went initially to see an osteopath and he did quite a lot of manipulation 2-3 times a week for about 6 weeks, I guess, but the most relief I ever got was maybe a couple of hours. I could get into the car and get home, and but within a couple of hours, if I did anything other than sit in a chair, it kicked back in again. So I was taking significant quantities of diclofenac. I went to my GP and he referred me on to a back surgeon. I went to see the back surgeon, he took some scans and offered me surgery. Quite luckily, in retrospect, I didn't take particularly to this guy and decided to go home and do a bit more research. We're now sort of 6 weeks, 8 weeks down the line, I guess. I found another surgeon, went to see him. He did some more pictures of my back and diagnosed stenosis and also a couple of disc problems. He said that I was borderline for surgery, but he recommended that I take a new therapy via a guy that he knew, and he gave me Robert's number, Robert Shanks. I went to see Robert. Robert looked at the scans and said that he felt that he probably could help. I did an intensive course of IDD, probably 15 or 20. After the first 5 or 6, I was getting significant relief. I mean, up until that point, I really struggled to walk across a room. My life came to a standstill, really. After the course, I was basically as good as new. I'm back to walking. I don't get any referred pain. There's been no relapse. I do go every 8 weeks for a maintenance top-up, and I do my exercises as directed by Mr. Shanks. I walk 8 miles 2-3 times a week, and before Christmas I got lost and I did 20, and there were no ill effects at all on my back. I feel very strongly that I was within a gnats of being put on an operating table and having my back opened up and surgery taking place, and now I feel I'm a million miles away from that. I can walk as much as I like to. I garden, and the most I ever get is the age-related muscle ache. Outside of that, my back is perfect for me, but I do keep up with my maintenance. The IDD stopped the course that I was on for me. I was well on course for having surgery with one of these two guys, and in the end I didn't have to have it. We're 4 years down the line from the incident now, and I guess 3.5 years since I first saw Robert, and I've had no problems at all. So I would highly recommend it, and I do, to anybody who's got severe back pain. I am very grateful that I found Robert and his wonderful machine. Okay, thanks.